1 out of every 3 people suffer from some form of allergy. That's why we created Allergy Insider, the go-to resource for all things allergy. From common causes to symptoms and testing options, we have you covered. Visit allergyinsider.com.
Good evening, everyone, and welcome to our very first Allergy Insider live stream. We hope that you and your loved ones are staying safe and healthy. Tonight, we're discussing food allergies, the different types, symptoms, and treatment options. Please be sure to place all of your questions in the chat box, and we will address them a little later on in the program. Joining me this evening is Professor Claudia Gray, a pediatrician who is subspecialized in allergy and who runs the Kids Allergy and Pediatric Clinic at the Vincent Pallotti Hospital in Cape Town. She's also an associate professor of pediatrics at the University of Cape Town and a consultant at the Red Cross Children's Hospital. Claudia has published over 100 scientific papers, several book chapters, and is also a children's author. Good evening, Claudia, and welcome to our very first live stream.
Hi, Pranusha. Thank you so much for the invite to be here.
It's really great to have you join us this evening. So if we get straight to it, Claudia, what is a food allergy exactly? And what are the common types of food allergens that might trigger a reaction in a patient?
So, Pranusha, a food allergy is an abnormal immune response. So it's mediated by the immune system to a food which should actually be harmless. So most of us should tolerate peanuts and eggs and milk and wheat without a problem. But in some cases, some people who are allergic ingest that allergen and their immune system sets up an abnormal response which overreacts to that allergen, and it almost wants to fight against that allergen, leading to symptoms such as rashes or shortness of breath or gastrointestinal symptoms, which we'll describe in greater detail later. Now, food allergies, by definition, can occur to any food proteins out there, but universally, there are certain more common food allergens. And worldwide, we call it our top 6. So cow's milk, hen's egg, nuts and peanuts, seafood and shellfish, and soya and wheat are the most common allergens by far. And then we can have some local nuances. For example, in Israel, sesame seed allergy is particularly common. And in France, mustard seed allergy. And in the Mediterranean countries, peach allergy. So we have some allergens that are common everywhere in the world and some that are specific to certain geographical locations.
So if a patient is experiencing a reaction, what are some of the common symptoms that they should look out for?
Well, this is a very broad question. So very broadly, there are 2 main types of allergies. The more common one is called an IgE-mediated allergy or an immediate type allergy. And the slightly less common one, which tends to occur mostly in younger kids, is called a delayed type allergy or non-IgE mediated. So I'll start with the delayed type just to get it out the way. For example, a very young child with severe colic and reflux and an eczema rash may well be allergic to cow's milk protein in the formula milk or transmitted by the mum's breast milk. So their symptoms are more subtle, they're delayed. Sometimes it's hard to recognize whether it's an allergy or not. Then we get our more common type of food allergy, which is our immediate type or IgE mediated, which classically presents within seconds to 2 hours by definition after ingesting the allergen that we are allergic to. And that can cause a wide range of symptoms. So allow me to go system by system. So let's start with the skin. Very common is skin involvement. So hives, redness, flushing, measles-like rashes, or slightly lower down in the skin, in the subcutaneous tissue. If there's a reaction there, you can get swelling of the eyes, swelling of the ears, swelling of the lips. And then our gastrointestinal system can be involved, so the gut. So often people present with vomiting. Sometimes it can cause tummy cramps or diarrhea. Also, the eyes can be involved, itching, running eyes, and equally so the nose, sudden running of the nose and extreme itching. The neurological system can be involved. People can become withdrawn or irritable. In children, we often see them starting to cry and cling to their mums. In adults, it's described as a feeling of impending doom. So you're almost panicking that something bad is going to happen. If you're very unlucky, you can get your respiratory system involved. And that, of course, is becoming now quite dangerous. So breathing difficulties, difficulties breathing in, difficulties breathing out, persistent throat clearing, or an irritating cough can all be a sign of an allergic reaction. And lastly, of course, your cardiovascular system. So this is more common in adults than in children. But if you're unlucky, your cardiovascular system is involved, blood pressure could drop suddenly, leading to faints or collapses or dizziness. And there are also some quite odd and weird symptoms, such as uterine cramps, for example, a metallic taste in the mouth. So our viewers can see that there's a wide range of allergic reaction. Perhaps a bit later, we can talk about what makes the most severe allergic reactions.
Absolutely, Claudia. That was brilliant. So you touched a bit on some of the more serious reactions, such as anaphylaxis, which coincidentally happens to be the theme of this year's World Allergy Week, which is happening this week. We have a really interesting clip to share with our viewers this evening. And when we come back, let's touch base on some of the questions that we have in our chat.
What are signs of anaphylaxis? Knowing them and what to do could save lives. Anaphylaxis is a life-threatening allergic reaction. It can happen immediately or within minutes after exposure to a trigger and can worsen rapidly. You should call your local emergency number immediately if someone is showing signs of anaphylaxis and get them to an emergency room as quickly as possible. Common symptoms you should be aware of may include hives, trouble breathing, tightness of the throat, vomiting, abdominal pain, dizziness, and low blood pressure. What causes anaphylaxis? The most common triggers are certain foods, insect stings, and medications. Foods are the most common cause in children and young adults, while medications and insect stings are more common causes of anaphylaxis in older adults. If you have had or think you've had an anaphylactic reaction and you haven't seen a healthcare provider, contact them for advice. They can safely use diagnostic testing to help identify what the trigger may be and provide you with an anaphylaxis emergency care plan. Find out more at allergyinsider.com/anaphylaxis.
So we have a few questions that have come up in the chat already, Claudia. And what I'm going to try and do is try to go through all of them in the time that we have left. So Anzel has mentioned that she has an allergic reaction to salicylate. And if you could tell her more.
Yeah, I think that's an extremely higher grade question for the first question. So salicylates, we're not now talking about a classical food reaction here, such as with our peanuts, etc. But salicylates are actually drugs. So they're found in medications like aspirin. So some people have a hypersensitivity reaction to aspirins or disprins, for example, mediated by the salicylic acid molecule, which is in that medication. But the interesting thing about salicylates, Pranusha, is that they are also found naturally in some foods. So some foods are naturally high in salicylates. So some people who react to aspirin also can react to very salicylate-rich foods and present with nausea or vomiting or even hives. So that's a very interesting example of a reaction in which medications actually overlap with certain food types. Please see your doctor. There are tests for salicylate allergy. Sometimes people have to go on a specialized diet, and sometimes it can also present with aspirin-related respiratory disease, such as polyps in the nose or severe sinusitis or severe asthma. So it's worth recognizing because a desensitization program may be of particular use in that type of allergy.
Great. I have another question that's come up in the chat box, which is related to shellfish. So someone has asked, if they have an allergy to shellfish, do they need to avoid all seafoods?
Very good question. And I suppose one could ask a similar question with peanuts and tree nuts. So the answer is no, not necessarily. The fish, so lionfish, are different to shellfish. So it could well be that you can tolerate hake and tuna and salmon, but you only react to prawns or mussels. So once again here, a very good diagnosis is absolutely necessary so that the patient is sure what they're allergic to and avoids foods accordingly. Often we have adults, for example, with one of the few allergies that can have their onset in adulthood is a shellfish allergy. So you may be able to continue to eat your healthy lionfish, but just avoid the shellfish groups. So we can tell apart the spectrum of your allergies by taking a good history and then undergoing specific allergy tests. So these tests would be different tests for all sorts of different type of fish and all sorts of different types of shellfish. And then we can pinpoint exactly what that patient's issues may be. So no, you don't necessarily have to avoid all seafood, but please have good diagnostic testing done.
Great. And Kim has also asked that she can tolerate foods with baked goods that contain egg, but she gets a sore stomach if she has poached eggs.
Okay, yeah, thank you, Kim. That's a great question. So with both cow's milk and hen's egg, we often have a spectrum of how well cooked the substance is. So both of them can occur in their rawest form. So fresh milk, fresh cream, fresh butter, or in the case of egg, raw egg in mayonnaise or raw egg in batter. And then we have the next level up. So for egg, this would be, I always say to my patients, anything prepared on the top of the stove plate. So fried egg, scrambled egg, poached egg, omelets, even pancakes or meatballs that are bound with eggs. And if you have a true egg allergy, one normally cannot tolerate the raw egg and the lightly cooked egg. But in fact, in 80% of cases of egg allergy and indeed milk allergy, the well-baked form in which egg or milk is a minor ingredient can be tolerated. So for example, if you make a batch of muffins and there's one egg per batter and it's cooked at 180 degrees for 20 to 30 minutes, the egg is denatured by the heat. And so the egg allergic person may well tolerate that because the body no longer recognizes this as egg. But remember, this is in 80% of people, and there would be 15 to 20% of people who are allergic to all types of egg, including the baked egg. But more commonly than not, baked products are tolerated because the heat breaks down the protein and fresh products are not. And remember, in children, egg allergy is often outgrown over time, and often the first form of egg that they can eat is the baked form of egg.
Okay, great. Very interesting. We also have Irene in our chat box who struggles with nut allergies. And she asks, does she have to stay away from all nuts, or is it possible to eliminate certain nuts and just the ones that she's potentially allergic to?
Good, another great question. So here we also need to recognize, which is sometimes not well understood, that peanuts are very different to the tree nuts. So peanuts are a legume. In Afrikaans, it's a grondboontjie, so it grows on the ground, whereas tree nuts grow up on trees. So if you have a peanut allergy, you have a slightly greater chance of a tree nut allergy, but not necessarily. So we have lots of people who can't eat peanut, but they can eat all the tree nuts. And it's really important for us to recognize this so that we can advise them accordingly. Of course, the modern way with allergies is also to say if you're not allergic to a food, it's better to eat it regularly so your body doesn't forget about it and develop an allergy. So for children with a peanut allergy, for example, we normally do quite wide testing to look for associated allergies. So we test the peanut, we test associated legumes like lentils or chickpeas. We would test associated seeds like sesame or sunflower. And then we would test an array of tree nuts. And then we can tell exactly what they are allergic to and what not. Within the tree nut group, unfortunately, it's also not one size fits all. So the almond is very different to the hazelnut. The walnut is very different to the macadamia nut. The cashew nut is very similar to the pistachio nut. So some nuts are grouped together, but most nuts have got their own personalities, I always say to my patients. So if you're allergic to the cashew, it doesn't mean that you can't eat Nutella, which is hazelnut based. So your doctor should very carefully order the correct tests to see exactly what you are allergic to.
And that kind of leads to my next one, is about how do we actually test for the different types of nuts? For someone that in particular has a peanut, which we know is not really a nut.
Yeah, so testing for immediate type allergies takes on two main forms. The first form is by a skin prick test, where we have a concentrate of the allergen, which we often have to get from our overseas sources. And we do a test where we put a drop on the skin and we prick through with a tiny little lancet just through the top layer of the skin. And we wait 15 minutes. And if you're allergic, it comes up in a hive. And we measure that hive so we can follow it up over time. The second way of testing is by a blood test. So these tests are specific for each allergen. So you can't say nut test. You have to say peanut, cashew, pistachio, because they all have specific reagents and specific blood tests. So skin prick testing or blood testing by something called specific IgE are the two main ways to check for nut allergies and indeed other IgE-mediated allergies.
I have another question in the chat box, which is asking if it's possible to outgrow an allergy.
Yeah, so this is important because when we are seeing people with food allergies, we need to be able to counsel them about the possible course that they're going to run over time. So here, once again, every allergen is different. So cow's milk allergy, dairy allergy is often outgrown towards school-going age and even up to the age of 16 sometimes, similar to egg allergy and soya allergy and wheat allergy. So those four allergens are more often than not outgrown over time. Some adults are unlucky enough to still have them, but most people outgrow them. Contrary to this, the nut group, the peanuts as well as the tree nuts, and the seafood group, so the lionfish as well as the shellfish, are more often persistent allergies or lifelong allergies. So there, the ratio is reversed. Generally, 80% of them have them for life, and only about 20% of people outgrow them. So the course of your disease will be determined by the actual allergen that you are allergic to.
That's quite interesting. Something I've always wondered is we talk about outgrowing allergies, but is it possible to develop an allergy much later on in life, like in adulthood, for instance?
Yeah. Pranusha, unfortunately, yes. Certain allergies can creep up on us over time. So the two allergen groups that stand out there are the nut groups and the seafood group. So it is quite possible for an adult who seems to have been fine with peanut butter or cashew throughout their lives to suddenly in their 40s develop an allergy to the seafood group or the nut group. The other allergy that can develop later in life is an allergy to preservatives. And then there's a whole other group of allergies that's more common after your teenager years and in early adulthood. And those are called the cross-reactive syndromes. And these syndromes are very interesting because actually your initial allergen is often an airborne allergen like pollen, tree pollen or grass pollen. And after you've had that for a few years, your body starts confusing certain foods with pollens because there is one, sometimes two similar allergens, so similar slices of the pie that look the same to the body. So we do get situations in which someone who hasn't really had a food allergy before, but for example, has a birch pollen allergy, which is common in Europe, Germany, and the UK, for example. And when they're in their 20s or 30s, they suddenly start getting itching of the mouth when they eat hazelnuts or cherries or apples, and they don't understand this. But this is a cross-reactivity syndrome where the body is confusing the air allergens and the food allergens. So yes, certain allergies can develop later in life.
So it seems we don't escape it once we're adults, unfortunately. And
Look,
Zara in our
people
chat
do.
box.
Yeah, most people do,
Just a few
but you
unlucky
always
ones
have to
get
be on the
there.
lookout. Yes, absolutely.
Absolutely. So Anzel has now mentioned that she wants to know what are some of the most common delayed responses in relation to an allergy to cow's milk?
Okay, so there's a whole spectrum. So the first thing to say is that this is not common in adults at all. It's far more common in little children. So we also have different types of delayed allergy. So this is a huge range. It can range from severe colic or severe reflux in a baby who's just not seeming to get better, especially if they've got other signs of allergies such as eczema at the same time. We can get what we call a cow's milk protein enteropathy, where more of your gut is involved, and those kids can start having absorption issues and get diarrhea or even blood in the stool and start failing to thrive. So they start not gaining weight because they're losing a lot through diarrhea. And then we get an entity called proctocolitis, where just a tiny segment at the end of your bowel is involved. And that typically presents with blood-stained stools in a healthy, thriving baby, because only the end of the gut is involved. They don't have absorption issues, but that can be quite scary, having fresh blood in a baby's stools. There's also an entity called FPIES, which has actually become more common over time. And FPIES stands for food protein-induced enterocolitis syndrome. And these kids, more often than not, present with severe vomiting, sometimes even to the point of shock and dehydration, typically 1 to 3 hours after ingesting the food they're allergic to. So often they are misdiagnosed as infection or sepsis until the pattern emerges. Oh dear, it's every time my child has had oats that they vomit like this to the point of dehydration. So there are many manifestations of delayed type allergies, for example, to cow's milk. And there are milder ends of the spectrum as well, just motility issues such as constipation, because your gut is moving in a haphazard fashion when you've consumed too much cow's milk protein.
Great stuff. So Charisse has had quite a nasty reaction, and she's mentioned that she had an allergic and a reaction, not only just allergic, but an anaphylactic reaction whilst drinking rooibos tea. And at the time, she was 15 weeks pregnant with her firstborn. So what are the options for someone like Charisse?
The first, I think also our viewers need to know what anaphylaxis is by definition, because we haven't actually properly defined it. We've looked at the spectrum of food allergies, but by definition, anaphylaxis means 2 or more systems are involved. For example, skin and gut at the same time. And any involvement of your chest or your airway and any involvement of your heart system makes up anaphylaxis. So if you just have a rash or you just have vomiting, that's an allergic reaction, but not anaphylaxis. It's not the severe end of the spectrum. But if 2 or more symptoms are involved, any respiratory, any cardiovascular, that's potentially life-threatening. So I'm not sure if she did have all of those symptoms. Now, rooibos tea is an extremely challenging one because it's a very rare cause of allergic reactions. But one observation that we've made at times when people are going through major hormonal changes, such as teenagers, pregnancy, menopause, is that many people have what we call chemical reactions. So it's not actually a food protein, but it's the richness in the tannins or the, in some cases, the salicylates, for example, or the histamines, which are naturally in food. Rooibos, in fact, is quite a histamine-rich drink. So sometimes people are actually just reacting to the chemical rather than the protein in the food. So this is more of an irritant reaction, but it can certainly mimic an allergic reaction. Another example would be people reacting to fermented food or very moldy cheese. It's full of chemicals such as histamine and tyramine. So you're actually just ingesting chemicals, or fish that's gone off over time builds up a lot of histamine in it. So we'd have to take a very careful history in the case of this lady with the rooibos tea to see whether it was actually just a chemical reaction or indeed an allergic reaction.
Thanks for that, Claudia. We have one more from Shraddha, who asks, what are the common symptoms of being allergic to dairy?
Okay, so this really, dairy can span the entire range of allergic symptoms that we've already described. So we've mentioned now about the delayed type with the diarrhea or the blood in the stools or the vomiting, which is more common in the young baby. In older kids and adults, we have the spectrum of just getting a rash around the mouth, for example, when you have yogurt or a piece of cheese, or tummy pains, vomiting, diarrhea, or breathing difficulties, or indeed, I have even seen adults who have collapsed from dairy. So there's a wide spectrum with dairy, from delayed to immediate through to anaphylaxis.
Sivit is asking quite an interesting question. Are there any cures for food allergies?
Yeah. So sometimes the cure is time. So as we've said, some children outgrow milk allergy or wheat allergy or egg allergy or soya allergy. But other than that, most allergies don't actually have a cure per se. So avoidance and risk management are the management strategies. So we avoid the food, we minimize our risk, we read labels, and then also we know how to respond if there has been an accidental intake of the food. So knowing what medications to take, what symptoms to look out for, having an emergency kit and having an emergency plan. So these are all reactions, they are not cures. Of late, there has been more and more experience, which we're also doing in our allergy clinics, with a process called desensitization or specific oral tolerance induction, where we're actually giving allergens like peanut in very controlled minuscule amounts and building them up over time, over several months, to reach a maintenance dose, which is protective mainly against accidental ingestion of, say, the peanut, for example. So in itself, this is not a cure, but it's a raising of the bar. So it can take some of the angst and anxiety out of sending a kid to school and worrying that they're going to have a bite of peanut butter sandwich and die. So at least if you desensitize, you have a higher threshold. Sometimes the desensitization leads to cure, but this is still work in progress. And it seems that probably 30 to 35% of the kids or adults who've been through desensitization actually get long-term cure. But this is something that's still under investigation. It's a similar concept with desensitization to environmental allergens, for example. If you're allergic to dust mite, you can take under the tongue, a sublingual spray over time, which converts your immune system to liking it rather than hating it. And bee allergy. So we do lots of bee allergy desensitization, where our clients get injections of tiny amounts of bee toxin. And over time, the venom amount increases and the concentration increases. They come every week for a new injection. And this shifts the immune system into accepting the bee rather than rejecting it. So this is the process of desensitization.
Great stuff. So Claudia, I've seen a really interesting question that's come up in the chat box that's asked, what's the difference between a food allergy and a food intolerance?
Okay. Sure, Pranusha. This is a very important question, actually, because many people think they have an allergy and they actually don't. And sometimes this takes the spotlight off those who are truly allergic. For example, the fad with gluten intolerance and wheat intolerance, some people truly are, but some people aren't. And then those who truly are wheat allergic somehow get sidelined because people think, oh, just another wheat intolerant person. So an allergy, by definition, involves your immune system. So you're reacting to this food as if it's an enemy. Your immune system is scattered all over the body. So that's why your chest could react, or your heart could react, or your skin can react, or your gut can react, or your brain can react by becoming drowsy or lethargic or scared. And intolerance, by definition, does not involve your immune system. So usually it's more of a digestive issue and is often localized to the gut. So for example, someone with irritable bowel syndrome may be intolerant of wheat. In other words, if they have too much wheat, they get tummy cramps, they feel uncomfortable. Sometimes it can lead to constipation or diarrhea or even headaches. The difference is that an intolerance is not dangerous. It's just annoying. And often in an intolerance, you can tolerate a bit, but you can't tolerate a lot because that overwhelms your digestive system. Whereas in an allergy, you can't tolerate any at all in most cases. So I hope that helps to clarify the difference between the immune-mediated allergy and usually the localized gut-mediated intolerance.
Great. We also have a very interesting clip for our viewers. So I'm going to ask the team to play that quickly, and we'll come back in a little while.
Food allergy or food intolerance? Find the answers you've been looking for. Food allergies and food intolerances have many similar symptoms, like bloating and cramping, but they're not the same thing. Allergies can be life-threatening, while intolerances are not. Did you know that up to 250 million people suffer from food allergies, and more than 170 foods are reported to cause allergic reactions? Because food allergies are a potentially life-threatening immune system reaction to something that's harmless for most people, like proteins in milk, eggs, and nuts, it's vital to know what your underlying allergic triggers are so you can be confident with your food choices and take control of your symptoms. So how can you tell if it's a food allergy or food intolerance? Along with your patient history and symptoms, one single blood test may help your healthcare provider identify if your symptoms are being caused by an IgE-mediated allergy or are likely to be an intolerance. Knowing your allergic triggers enables you to manage your condition appropriately. Find the answers you've been looking for. Ask your healthcare provider for a specific IgE blood test today.
So Claudia, we've talked quite a bit this evening on the different types of allergies, the symptoms, and answered quite a few questions from our chat. But what does a patient do? What are their next steps? So what kind of resources are available to them? And what kind of questions and testing options are available out there?
Yeah, Pranusha, I think as mentioned by the video, it's incredibly important if you suspect you have an allergy to go to the right person and really sort it out properly. So not to think, oh, do I have an allergy? Do I avoid this? Do I not remember? Especially in children, unnecessary avoidance can actually lead to allergies and loss of your tolerance if you are not exposed to something for a long time. So in terms of finding out what your allergen is, please go to your doctor. You can start with your family doctor or your physician or pediatrician. We are lucky enough that allergology or allergy has become a subspecialty. So there are many allergy specialists now in South Africa, and they should do a stepwise approach. So first of all, take a very thorough history. As the patient with the rooibos tea, we have to decide, is it just a chemical reaction or is it actually a potentially dangerous allergic reaction? What are the possible associated allergies? Children with egg allergy often have a peanut allergy as well. People with a tree nut allergy sometimes have a sesame allergy or a peanut allergy. So we need to not only talk about the thing that you have reacted to, but the possibilities of their friends and their relatives and the things other things that you may be allergic to. So that's the history. And a good examination, because it's fairly uncommon to have a food allergy in isolation. Normally, the sufferer may have other allergies such as eczema or asthma or allergic rhinitis. So we have to minimize risk in all of those systems. If you have asthma, for example, it puts you at greater risk of anaphylaxis if your asthma is poorly controlled. And then we come on to the testing. We've already mentioned some modalities of testing for our IgE-mediated allergies, as in skin prick tests and specific IgE blood tests. For the delayed type allergies, the skin test and the blood test don't really help, I'm afraid, because it's not mediated by the specific antibody called IgE. So there often we have to take something out the diet, see an improvement, and then re-challenge and see a deterioration. But we cannot stress enough that it's important to know exactly what you are allergic to, so you can identify, you can avoid, you can risk mitigate, you can label read, you can have an action plan, you can have emergency medications, and be absolutely prepared in case there is a reaction. And of course, follow up over time is incredibly important. So the allergic patient needs to be seen, especially in children, once a year or even once every 6 months to see, have they outgrown that allergy? Has it got worse over time, etc. So I hope that helps to guide the viewers.
Absolutely. And, I wish we could continue this discussion for much longer, but unfortunately, we have run out of time. Claudia, thank you so much for joining us this evening and sharing your knowledge and valuable insights with our Allergy Insider community. We really appreciate your time.
Thank you, Panusha, and thank you for the wonderful resource in Allergy Insider. We've also do need to mention the Allergy Foundation of South Africa, www.allergyfoundation.coza, which has also worked very hard towards the World Allergy Week, which is currently running. So thank you. We really appreciate being able to join you.
Thank you. And to our viewers out there, please be on the lookout for the coming up posts and polls on our page to find out what other topics you'd like covered in our next live stream. We hope that you also are able to access our website at www.allergyinsider.com. So all of you out there, thank you once again for joining our live stream today, and we hope that you and your loved ones continue to stay safe. Take care. Good night.